I'm Debbie Chase and I'm the Director of Public Health for Southampton. I'd like to talk to you about my annual Public Health report for this year, which is on working together towards a healthier Southampton. The report covers the importance of good work for health, the progress we're making towards improving access to health and working conditions, and it also provides opportunities and practical tools to support employers to improve staff health and well-being whilst future-proofing their businesses and increasing growth. Southampton has a rich maritime history of manufacturing and industry, and as we move forwards into retail and opportunities, of course, with health and education. As we go into the future, we're one of the greatest growth cities in the country. And we're seeing growth in terms of digital opportunities and the green economy. So it's an exciting time. But Southampton also has challenges. We have challenges in terms of levels of deprivation. We have challenges in terms of existing health conditions. We know that over 50% of our residents in Southampton have at least one long-term health condition, be that a heart problem, a respiratory problem, mental health issue, and that makes it more difficult to get into work and equally continue in work. So we must support people with health conditions to be in work for longer. Southampton can be a healthier city and a more prosperous city, and that's what this report's all about. And it includes case studies of great practice and opportunities to improve health and well-being and improve productivity at the same time.
My name's Jodie Fair and my job title is Programme Manager. It's really important for businesses in Southampton to really think about health in their overall policies. You know, we know a lot of key things in that healthy workplaces are workplaces that perform well, that, experience high growth, low turnover, which in turn really makes a difference to the bottom line. Solent Business and Skills Solutions can really support employers in thinking about health and wellbeing within their workplaces. We've got a real innovative online system which health is one of our key topics, so employers can explore what health means to them, how they can reduce sickness, turnover, things like that, and make sure that their workplace is a really good place to work. If we reduce sickness, if people are happy and healthy within their workplace, we reduce their recruitment costs, we find people stay with us longer and really engaged as a workplace. What we need to make sure is that work is never contributing to a person's ill health. We want to have a healthy, supportive workplace that enables people to grow.
My name is Gregory White. I'm the founder and director of Drop the Mask Production CIC here in Southampton. We have a high percentage of neurodiverse staff and volunteers, and creating those environments and creating those support structures for us is a bonus. You're giving people what they need, not what you think they want. And for us, we feel that's really important. And the tangible benefits are financial. They are in having a stronger team, a more open conversation within the office, and comments coming back of people feel a relaxed environment. Now we can measure looking back and thinking, wow, this really does work.
So now I'd like to talk about ways in which employers can practically make a difference. First of all, there's the Good Work Charter. That has 10 points in it. If you focus on those 10 points after undertaking a needs assessment to understand your workforce and its health and wellbeing needs, you can really make a difference to improve your productivity and also improve the health and wellbeing of your workforce. The second opportunity is for anchor institutions. These are organisations that are embedded within a local area, like our hospital, our city council, our universities, big employers that have a massive influence on the people they serve and the individuals that are within their workforce. And you'll see those 5 points in ways in which we can boost the local economy, support us to have a greener economy, and protect and support local residents and their workforce needs. It's important that we look to the future now to make sure that we can improve employment practice and conditions to improve health and wellbeing of our local population. So I have a set of 4 recommendations for employers to really support health and wellbeing and improve productivity at the same time. My first is that we actively maximise your influence as an employer in delivering health and prosperity for the city. And this can be done through widening access for good work, closely working with partners across the city and improving practice, purchasing locally for social benefit, using buildings and spaces to support communities, and placing efforts on reducing environmental impact. My second recommendation is that as an employer, you recognise the needs of your workforce. So undertake a needs assessment to understand those health and care needs. Thirdly, to adopt the principles of the Good Work Charter, which offers businesses opportunities to benchmark their employment and skills, and it has a supportive toolkit that is a resource that can help to contribute towards better workplace health and wellbeing. And then lastly, instilling leadership that brings about a change in culture, whereby the way we work is organised that promotes good physical and mental health. Staff wellbeing and health, both at work and at home, needs to be seen as central to every part of the business and a corporate responsibility. So those are my 4 recommendations, and we can support Southampton to grow our economy, to be more productive, and most importantly, improve the health and wellbeing of our residents. Thank you.